Morning, everybody. It's JB again. Ooh, ah. So, here we are today, the 25th of March, and we seem to be deep into the zombie apocalypse. And keep in mind throughout this whole conversation that I'm fixing to have with you all that I don't in any way take this thing lightly. It's a very serious disease. And I think that in years to come, there will actually be regimes and countries, or at least the leaders of countries, held responsible for this global pandemic. That sounds crazy, but the more research you do into ground zero of the virus, where it actually came from, the country of origin, the more research you do into how they handled the situation, the more frustrated you become. I like to share a little bit of hope and a few facts and some perspective right now, because this world is in dire need of perspective. There's plenty of facts out there, but they seem to have been manipulated by certain outlets in order to cause mass hysteria, and that's not what we need right now. What we need right now is hope and calm and a diligent effort to beat this thing. So we are on day, I think, 10 of the president's 15 days to slow the spread plan. And hopefully this time will have given us as a nation an opportunity to step back, to see what we're really dealing with here, to get some idea of the spread of this thing and how it's affecting people, the death rate, different medical possibilities for helping people out, medication and therapies and everything else. So hopefully we will have used this time wisely. Yes. Worldwide, we're over 400,000 cases. I think over 19,000 deaths at this point. What you have to consider, though, is that there are a lot of people out there not reporting. There's a lot of countries out there that don't have the same medical care and facilities that we have here in the States. So, say in India, if you live out in the country, you may not ever see a doctor. You may have this and get over it. You may have it and pass away, unfortunately. And no one will ever know that you had COVID-19, the Wuhan flu. So here in the States, as of this morning, we have 54,000. I don't know if you can see that. 54,973 cases, known cases. And we have 784 deaths, unfortunately. That's nationwide. About 60% of all cases are in New York City. That seems to be the ground zero for the United States right now. There's probably lots of reasons for that. One of which is that it's such a massive city and the people there are so packed in together. It's a very close-knit city. So lots, millions of people. So hopefully the rural areas of the country won't be affected as bad as they have been. And hopefully they will continue to receive the supplies and personnel to help them through this terrible time that they're seeing. One thing I'd like to mention is that those cases, the 54,973 cases, that's nationwide, out of about 350,000 tests that have been performed on the citizens of this country. So we're about 350 million people in this country. So that means we've tested, if my math is right, we've tested about 1% of those people, 1% of the United States population. That doesn't sound like a lot, but that's a lot. It's extraordinary how many people we've tested in 8 or 9 days. We have now tested more people in this country in 8 days than South Korea has in the entirety of the outbreak. That's American ingenuity for you. That's the power of the community of America coming together, private businesses, government businesses, getting things done. So that's a blessing. That's a godsend. So, only 54,973 cases. So let's do the math on that real quick. I'm back. I did my math. Math was never my strong suit in class, y'all. So it takes me a while to figure this stuff out. And I had to have some help from my calculator. So far, according to the president's briefings and the CDC and Dr. Birx and all that, in this country we have tested about 350,000 people for the coronavirus. These are people that were presenting basically all the same symptoms that are caused by coronavirus, which I have a story about that here in a minute. But we'll get there in a minute. 350,000 tests, and of that, 54,973 people tested positive. So, if you take those numbers, you can get a rough idea of the percentages that we're talking about nationwide. It's a small sample size, but it's big enough to where you can extrapolate that from it. About 350 million. We tested 350,000. Of that, you can extrapolate that about 15% of the people in the country are infected. Now, it may be different. Maybe more people in this pocket, say New York, are infected than there are people over here in Nebraska. Okay, but roughly, nationwide, it's going to be about 15%. That's just the people that we've tested, and that's just the people that have come forth to be tested. A lot of people, I think, as testing goes along, we're going to find out that a lot of people have already had this disease and recovered from it. And so your numbers of infected are going to go up, and your death rate's going to come down. And we'll get to the death rate here in a minute. Remember, I'm trying to give you facts and perspectives and hope here. So, 15% infection rate, and that doesn't count the people who never reported. Okay? My own experience with this has been, I don't know if I had Corona-19 or not, but I'm pretty damn sure I did, and I'm pretty sure my niece, my daughter, my wife, and my brother-in-law had it. And this all started back in late November of 2019. My brother-in-law is still getting over his sickness. My niece, this all started when my niece got a fever for a couple days, low-grade fever, coughing like crazy. This was back in November. I mean, coughing like crazy. She coughed so much she pulled a rib, as did I later when I contracted whatever it was. Lots of chest congestion, fatigue, body aches, chills for numerous days. She went to the doctor, got tested for the flu, negative. Got tested for strep, negative. They didn't know what it was. They said, you have an upper respiratory infection, go home. That's it. My daughter caught it and had the same symptoms, except she had a mild fever for a couple hours in the morning, and then it would go away all day, and then she would have it again in the afternoon. Later, when I got my sickness, it did the same thing. My daughter also coughed nonstop for about 10 days. And her fever lasted for about 10 days, off and on. Took her to the doctor. She was tested for flu, tested negative, tested for strep, tested negative. The doctor then sent her tests off, her samples off to another lab to test for a different kind of strep. Evidently, there's different kinds of strep. I didn't know that. I do now. They called us a week later and told us that they didn't know what it was. They tested it for everything. They tested her samples for everything they knew to test for and just told us they had no idea what it was, and she just had some kind of virus. She'd have to get over it. Okay. Then I get it in mid-December. I had a fever of 101.5 for a couple hours in the morning. The rest of the day, I would not have any fever. And then at 5 o'clock in the afternoon, every day, on the dot, like clockwork, I would get a temperature again of 101.5. That continued on for about 9 or 10 days. I had severe chest congestion. I don't know if you'd call it shortness of breath, but I was really tired. I've never coughed that much in my life. I coughed so much that I bruised a rib or pulled a muscle or something, and it hurt like crazy. On the 6th day, I rolled out of bed. I was experiencing, the whole time, besides the fever and besides the fatigue, I had body aches and chills and sweats and diarrhea for several days. Bad. I know. TMI. Ooh. On day 6 of me being sick, I got up that morning and I coughed up blood like you wouldn't believe. And I think it was just from coughing too much. Coughing a whole lot. But at that point, I'd never coughed up blood before, so I thought, I must be dying. I must have pneumonia or something. I'm going to the doctor. Went to the doctor, and they tested me for flu. Negative. They listened to my lungs. They never did perform an x-ray, but they listened to my lungs with a stethoscope, and she said I sounded very congested, but I didn't sound like I had pneumonia. So I don't think I did, but whatever. They gave me Augmentin, which are really big. They're like this big, horse pills, a very powerful antibiotic for 10 days. And she gave me some Sudafed cough syrup. And I went home and I started taking the medicine. And my experience with medicine, well, with antibiotics, has always been that whether I had strep or a sinus infection or whatever, as soon as I start taking the antibiotics, when I'm about 2 or 3 doses into it, my fever goes away. My whole life, this is how things have happened. This has been my experience. 2 or 3 doses into the antibiotic, my fever always goes away, and I start feeling a little better. The next day, I just keep improving from there. The next day, everything else. My fever stayed with me 3 days into taking the Augmentin. And I coughed for another month. Uncontrollably. Just cough, cough, cough. Could not stop coughing. I've never coughed that much in my life. I did finally get over it, but it took a while to get over it. Did I have COVID-19? Have no idea, because when I had whatever I had back in December, they weren't testing for it. It wasn't a big deal yet. It was still in China, right? That's another thing we'll get to, too, is I think that these numbers right here are going to change, because there's a lot of people that they're finding that had this disease way before they thought it got over here. Okay? So, did I have coronavirus? I don't know. I can tell you this. I suffer from seasonal allergies. pretty much year round. So I am familiar with all the symptoms of sinus infections and allergies and all that stuff. This was not a sinus infection, and it wasn't allergies. I've had the flu a few times in my life. I've had lots of colds. This was not anything like this, like what I had. It was flu-like, but I mean, hell, I got tested for flu, and it was negative. Did I have it? I don't know. Like I said before, I'll take a serology test, whatever, see if I have antibodies to it. Because if I can help somebody with my blood or plasma, I would, So whatever I had, it's not the worst disease I've ever had, but it put me down for a good couple weeks, man. So bear that in mind. Then my wife got it. She had much milder symptoms than me, but she coughed and coughed and coughed for probably a month and a half. The doctor told her that she had a sinus infection, gave her, it wasn't augmentin, but it was some kind of, gave her like a Z-Pack or something. Didn't do anything. Nothing. She ended up going to the grocery store and getting Mucinex and everything else to try to help her quit coughing, and none of that helped. She had to sleep like sitting up on a pillow to help with all the coughing, and it still didn't help. Then my brother-in-law got it. My brother-in-law is pushing 60, and he is in really good health. The man works out like every day. I've known this guy for almost 20 years, and I've never seen him get sick. Not like this. He had a slight fever for about a day or two, was feeling yucky, and then went to the doctor. Doctor said, well, you probably just got a little cold or something like that. And the next few days, he felt great. A couple of days after that, he woke up in the morning, felt like garbage, was extremely fatigued, sore all over, could not breathe. Went to the doctor, he had pneumonia. Like that. The doctor gave him 2 rounds of antibiotics, told him to go home and rest. They never checked him. Well, they checked him for flu, he was negative. They never checked him for COVID-19. This was at the beginning of, well, probably halfway through January when he caught whatever he caught. They never tested him for COVID-19. So 5, including myself, 5 family members had this weird, nobody knew what it was, respiratory virus that antibiotics didn't help. And there was nothing you could really do for it except your body just had to fight it off, and it took quite a while. Had a cough with it, just a persistent cough for what seemed like forever. All of our tests for flu came back negative. Tests for strep came back negative. Dr. Birx and the professionals with the president, and also governors of states and other health professionals are speaking about doing serology tests. Serology test. What it is a test to determine, it's like a blood test, I guess, to determine if you have antibodies for the COVID-19 virus. The only way you can have antibodies to it is if you've already had it and survived through it. That's what I've been trying to tell people around here is I have a theory that it's been here for a lot longer than what we think. I think it's been circulating through the global population for a while. There's no telling how long. It doesn't go from China to all around the world in a matter of a few weeks, especially since the whole world has closed down their borders and is practicing social distancing now. Think about that. The entire planet is practicing social distancing. There's no way it can spread if there's no travel, the borders are shut down, and people are staying away from each other. I really believe that it's been here a lot longer, and that these numbers of positive people in the U.S. and all over the globe are going to go up. The good thing about that is the death rate's going to go down. The more we find that people have had this disease already, and they've contracted it, their body has resolved it, and they have antibodies to it, that number of infected is going to go up, 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 and the death rate's going to keep coming down. Now, that being said, there's probably a lot of deaths out there that have been attributed to flu or pneumonia or whatever that was actually COVID-19. So, as it stands right now in the U.S., we have 54,973 cases as of this morning. That number is going to continue to go up, especially since we keep testing. It's going to go up. We have 784 deaths, unfortunately. That is a death rate of 1.4%. Not 3%, not 4%, not 8%, 1.4%. That's still a lot more than the regular flu. The flu is usually around 0.1%. I do believe, though, that then when these serology tests come out and they start testing people for the antibodies to COVID-19, they're going to find millions of people that have the antibodies. And that death rate should come down. It really should. The scary part of it is we don't know how many is infected. We really don't. I guarantee you it's more than what has been tested. Just here in Arkansas, the governor gave a directive to the Arkansas Department of Health to test mainly around elderly health care facilities. That's priority right now. Most people that have these symptoms, it's going to be mild. Most people that get the overwhelming majority of the cases are going to be mild. And you're going to get through it no problem. All the evidence points to, if you are elderly, so let's say 65 and above, and or you have serious underlying health conditions. These have been listed over and over and over by World Health Authorities, the CDC, Dr. Birx, everybody, Dr. Fauci. They all say the same thing. If you have heart disease, if you have liver disease, if you have lung disease, if you have severe asthma, if you are a smoker and you have COPD, if you're a diabetic and you have trouble regulating your diabetes anyway, those are serious underlying health conditions that can lead to complications with the Wuhan virus, that can lead to hospitalization or even death, unfortunately. I know this is scary, guys, and I know this is new. Never before in the history of mankind has the whole world been put on hold. And never before have we actually been able to see through social media and the news what's going on. I can watch what's happening in Italy right now in real time on my phone. That's scary because we're being inundated 24/7 with mass hysteria. There is concern. It's a concerning thing, this pandemic. I'm not taking it lightly, but some perspective and some facts and some numbers help. So what can we glean from this? What I'm getting from it is that the testing in the United States has really ramped up, so that's good. So we're getting a better idea of what we're looking at, number one. Number two, most of the country, at least from what I see here in Arkansas, most of us here are taking this social distancing and hygiene thing very seriously because we care about not only ourselves, but we care about our elderly. We care about those who are higher risk. People are finding ways around the social distancing to still have fellowship with each other. For instance, the churches. They're not allowed to meet anymore, but they can meet online. So lots of churches have gone to online. Our children are still learning via the internet. Our teachers are still teaching our kids. So we're going to make it through this. I do believe that this disease has been here a lot longer than what we think. That's why it looks like it's spreading so quick, but really it's such a long period disease. It takes 4 to 6 weeks for most folks to get over it. It did me, it did everybody in my family, if that's what we had. And let me tell you, I'll be the first one to take a serology test if it's offered to me. Because if I have antibodies for it, if I've already had it, I want to help. I hate needles, y'all. I hate needles, and I hate giving blood. I'll probably pass out. But if it'll help save a life, I'll do it. You know, if they find antibodies in my blood, I'll give it, man. I'll give you some blood. No problem, dude. But that's why it looks like they're going up so much, the cases. While this curve, everybody's like, oh God, we're not to the curve yet. We're just in the beginnings of this. Yeah, we're just in the beginnings of finding out that it's been here for a while. That's my perspective that I'm looking at it from. So anyway, there's that. And I think as the cases rise, we're going to find a lot more people infected, a lot more people that have had it and recovered, and the death rate is going to go down, hopefully, God willing. Also, something to keep in mind with the death rate of this thing is a lot of different countries that are reporting their numbers have a wide variance in the death toll. Here, it's anywhere between 0.7% and 1.4% as an average. In places like Italy, it has been as high as 8 to 10%. I mean, that's really high, man. And a lot of people, especially in the news outlets, are comparing Italy to America and saying that America is next. We're going to get it just as bad as Italy. And they could be right. I hope not. One of the things that you find, well, some of the things that you find when you do a little bit of research into Italy, number one, they have a high volume in trade and business with China. It's called the Silk Road. It hasn't changed in thousands of years. They have a lot of tourism from the Orient, and they have a lot of business wrapped up with the Orient. So that's number one. Number two, the Italians are a very gregarious people. Here in the States, we shake hands or we do a fist bump or whatever. Over there, they literally kiss each other on both cheeks. That's how they say hi. That's their greeting, which is great. But you can see how that type of thing would lend itself to a high infection rate. Number three, there's about 50 million people in Italy, and about a quarter of them, at least a quarter of them, are elderly. So this disease seems to affect older people more vigorously, the younger folks. I'm not saying that you can't get really bad sick or even pass away from this if you're younger, but the numbers are stacked against the elderly. And besides Japan, Italy has the oldest population in the entire world, so keep that in mind. Another thing is that a lot of the people that have been dying in Italy have one or more of those serious underlying conditions, those comorbidities, they call them. So keep that in mind. Italy's healthcare system, as far as I know, I could be wrong, it's a social healthcare system. It's socialized medicine. So they have limited resources. They have about 1,000, maybe a little bit less, hospitals in Italy for a population of 50 million. We have, in the United States, about 6,000 hospitals. That doesn't count VA hospitals, clinics, the MASH units that the National Guard's putting up right now in places like New York and Washington State. So even though we have a higher population and the math seems to add up, we have a lot better health system here. We also have a lot more medical professionals here. We have the infrastructure and the supplies. And that's part of what the president has been doing with all the governors, is trying to get everybody ramped up with supplies just in case the worst case scenario happens. But we have a lot better medical system here. Comparing the Italian medical system to the American medical system is like literally comparing apples to oranges. It doesn't make any sense. It makes sense if you want to freak people out, but that's about it. Also, keep in mind, up until about 2 days ago, Italy was still they still had no travel bans in place. They were still letting people go around the country and just do whatever they wanted to. They didn't really go on lockdown like us or practice social distancing like we are now until 2 days ago. And when this thing hit over there, it hit hard. That's another reason I think that this disease has been circulating around the globe for a lot longer than we think, because when it hit Europe, places like Italy, bam, they were just hit. They were overwhelmed immediately. And that is very unfortunate. That's very unfortunate. I just really think that this has been around for a while. And so keep that in mind. Also, our medical community worldwide, especially here in the States, are kicking ass. We know more than a few people that work in the medical profession. Some are nurses, some are doctors, some are people that take care of folks at nursing homes, and none of them are freaking out. They're all taking it seriously, but none of them are freaking out. And they are doing an outstanding job. And God has blessed those people to do that job. And God has blessed us to have people like that in our lives. So all y'all in the medical profession, keep going, keep doing what you're doing. You're literally saving the planet right now. There are also therapeutics that are being experimented with right now. One of them is hydroxychloroquine, which is a malaria medicine. One of them is azithromycin or a Z-Pak. Now, I understand the concept that an antibiotic doesn't do anything to a virus. I understand that. Duh. I think the point is that the antimalarial medicine, the hydroxychloroquine, used in tandem with the antibiotic, is producing a positive effect. So I think the antimalarial, from the way it's been explained to me, reduces the viral load in the body, especially in the lungs. And then the antibiotic backs that up by fighting any kind of bacterial infection that may have occurred. So evidently this thing attacks your lungs real bad. Like, you might as well breathe in razor blades, man. It's bad. So, other stuff can get in there and get infected and do damage. There's an awesome and miraculous story coming out of Florida right now. A man there was diagnosed with the Wuhan virus, COVID-19, and he was on a respirator in the hospital, had been there for several days, and evidently he had already said goodbye to his family. He was going to die. And he and his doctors were not expecting him to make it through till the morning. Word came down the wire from his friend that in Italy and France they had started using malarial drugs and a Z-Pak, the hydroxychloroquine coupled with a Z-Pak, to combat the virus. So he asked his doctor about it, and the doctor was reluctant, according to the story, because there was no clinical test done or anything like that. It was all anecdotal evidence. Well, the patient looked at the doctor and said, "Look, man, I'm dying. I'm fixing to die. What's the harm?" They gave him the medicine. They administered the medicine to him. The guy fell asleep, and in a few hours he woke up. He could breathe. Did you hear me? He could breathe. He called for the nurse to come take his vitals. His fever, which had not abated for 9 or 10 days, was gone. They tested him. The viral load in his body had already started to go down. So they kept administering the medicine, and now he's great. He is great just a couple days later. This man was literally at death's doorstep. And because of the doctors trying something new, that man is alive today. Yesterday, New York City started using the same batches of medicine with some of their patients, and I'm really hopeful that's at least going to be a therapeutic until that there is a real vaccine for this thing. I understand numbers, and I understand clinical tests and all that, and the safety issues and whatever, but come on, folks. What the hell do you have to lose, you know? I mean, if it works, it works. Let me define anecdotal evidence to you. Anecdotal evidence just means that something has been tried and people have had personal experience with that something, whatever it was, and they are relaying to you their experience with it. It doesn't make it any less meaningful than somebody running a clinical trial. The reason people run clinical trials is to, one, make sure it's safe, that the side effects aren't worse than the actual disease you're taking it for. And a lot of it has to do with legality too, because if you put something out on the market and it's not safe, or one person gets sick from it, guess what? You have a class action lawsuit on your hands. Think about all the commercials you see anymore for every medication out there. Class action lawsuit, class action lawsuit. I think that's got a lot to do with it. So I'm really hopeful about the medicines. I'm hopeful about the whole situation. We're going to make it through this. The death rate isn't nearly what we thought it was. I think the infection rate is much higher than we think it is. And I'm pretty sure a lot of us has already had this. They just didn't know what it was. They weren't testing for COVID-19 in the States up until the last couple weeks. So hang in there, y'all. We're going to make it through this. God is good. And I don't care who started this thing. I don't care where it started. It doesn't matter. God's going to finish it. You know, once in every generation or two, the world is faced with something like this. Spanish flu, a great flood, whatever, man. It's things like this come along every once in a while to test the mettle of man, you know. When I say man, I mean Mr. and Mrs. Man. For all you feminists out there, that's fine. I love you too. But it tests us. And I think part of it is, at least right now, is for us to take a minute, step back, take a deep breath, and remember that God's in charge, you know. Rely upon Him. So that's what I'm going to keep doing. It's scary. But when you have some actual numbers presented to you and some facts and a little bit different perspective, it's not so scary. So keep looking up, keep getting on your knees, keep calm, carry on. Love y'all. Bye.